let's talk a little bit about everything to do with aesthetics.
Yes. We call it pink static.
Pink aesthetic.
Yes.
Okay.
Which is to make it looks good, we need like the shape of the gum in the right position. Yes.
Out of 10 patients that are coming in for veneers, how many do you think are actually can get veneers done? Out of 10.
And the pink static is something that you don't see, but you see.
You don't see, but you see. You don't see, but it makes a huge difference.
Yes.
So when you tell somebody you can't get veneers, but you can get Emax crowns, it's gonna look just as good.
Yes.
Okay.
Yes. Nobody plans to fail,
Okay.
but a lot of people fail because they don't plan.
Oh, did you get that one?
Yeah.
Not a lot of people know, but I'm actually reconstructing my mouth, and Dr. Dulce is gonna be reconstructing my mouth.
And he's very picky.
And I'm extremely picky. And I said, if you think this is gonna be easy. Welcome back to Supreme Dental Podcast Studio.
Estos son podcasts, no chingaderas.
You can be anywhere else in the world right now, but you're here with us.
The level of mastery you have on dental work is extraordinary.
Do your research.
Perfect.
This is the podcast.
Welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us. We appreciate that. Don't forget to like and subscribe. Remember, this podcast is meant for you, our patients. My wife and I are the owners of Supreme Dental Clinic. And listen, we're on Apple Podcast and we're on Spotify. Don't forget to check out every other podcast that we have, including some on aesthetics, implants, after implants, and everything else. And today we have two amazing people here with us. We have, I like to call them our aesthetic squadron.
Yes.
I have Dr. Adolfo. How you doing, Dr. Adolfo?
Hello. I'm doing very good.
Dr. AD. And we have Dr. Dulce. How you doing, Dr. Dulce?
Hi. Great.
Great. Well, let's get to it, guys. Let's talk a little bit about everything to do with aesthetics.
Yes.
I love podcasts. I love this platform that we're given. We're blessed that we're given this platform because we're able to inform our patients about things that happen and don't happen in dental, what's real, what's not real, and what we see a lot here at the clinic. So I told you guys, let's prepare. There's two things what do you guys want to speak about in this podcast? And I believe you guys have certain things you want to speak about.
Yeah.
I don't know what they are. I think Dulce told me just a bit of it. I don't know if she wants to change it, but she still has time. So we're going to start with Dr. Adolfo. Tell me what you would like for patients that are looking for aesthetics, because you guys are all about veneers. You've gone to Prague. We'll put it up here where she's gone to Prague with, what is the dentist's name? I'm sorry?
Maxime Belograd.
Which is one of the best dentists for aesthetics worldwide recognized. And you just came back from Mexico City.
Yes.
And you won a contest, an award from a veneer contest there was people from Japan and also from Brazil and Mexico.
Yes.
And you represented. So we'll post that up also. So these guys are not just your average, I'm going to do a crown and let's see how it goes. You're talking about some heavy hitters here. So let's talk, Dr. AD. Tell me, what do you got to say?
Okay, very good. This is something very interesting. It happened all around the world. Even though in 2026, when the doctor says, okay, I'm going to do this restoration, which is not going to be very aesthetic because you have a lot of damage or have to do a big cover or the gums doesn't look good. So it will be functional, but not aesthetics. And
I've heard that a lot.
Yes. And also, in the other way, it happened the same. Okay, I'm going to do something really nice. It's going to look very aesthetic. You're going to smile with a bright smile. It's going to look very white. It's going to look good. But it won't be very functional.
Okay.
Your veneers are going to fail like in 1, 2, or 3 months, but it's normal because it's just aesthetics. And well, nowadays, we are in 2026. We don't have to choose between something aesthetic or functional. So we are working on the patient's mouth, you know? So I cannot deliver something which is not gonna work. So the outcome of our restorations are to bite and to eat something comfortable. So I cannot tell you, okay, this is gonna look good.
But it's not gonna work.
It's not gonna work.
But it's gonna look good.
Yeah. Oh yeah. I cannot deliver something which is gonna work, but it's gonna look horrible on the patient's mouth because the other side of your mouth.
Interesting. Very interesting. Yeah.
Yes, the other side of your mouth, it's the relation with other people. You need to smile and show something beautiful, something nice, something aesthetic. So I'm not gonna let you decide. Like, okay, I want to do something aesthetic or something functional. So here at Supreme, we know that I cannot deliver something aesthetic which is not gonna work, or something which is gonna work but it's gonna look awful.
You know, that's actually, you know, I never thought about that. That is something that really, that we see that a lot, is we see somebody that says, you know what, the doctor told me it was gonna work because of my case. It wasn't gonna look nice,
Yeah.
but it was gonna work. It's like having a house that's extremely ugly, but then, you know, it covers you from the rain. Which obviously functionality is what you want to have when you're eating, when you're biting, because obviously you're eating. But why not make it look amazing and also make it work? So what do you do to do functionality and also make it look very nice? Well, what are the steps you got to follow, or why can't people do both of them? How does it work?
Yes, first, the most important is the planning. So since the beginning, we know how is going to be the outcome because we have also a lot of experience and a lot of technology. We take pictures, we do picture of the patient's smile, of the patient's face, and we can match the correct side of the tooth, the correct inclination, make everything straight, all good with your face. But the first thing, it's make it stable. First, take care of the bone, the stability, all the if you have any gum issues, any bone issues, any tooth which is moving. First of all, see if it's savable, and if it's savable, okay, we are gonna take care of that first. Let you rest a little bit, like the healing process, like 1 or 3 or 2 months or 3 months in case of an implant. Once it's everything stable, see the gums. The gums is another part of the aesthetic. It's the 50% of the aesthetic. They like the we call it pink aesthetic.
Pink aesthetic.
Yes,
Okay.
which is to make it looks good, we need like the shape of the gum in
Gum
the right
contouring?
position. Yes,
The gum
that one.
gum contouring. Okay.
Yes.
Pink aesthetic. Okay.
After that, we can deliver something like the first level in aesthetics and also functional because we plan everything. Okay, I tell patients like, okay, you are coming for this, but if I just fix this part, it's not gonna work because of your gums, of your bone, or even your molars. The support of your bite is not good. So we gotta fix everything first, and then the aesthetic part is the last one.
It's like building a beautiful house in a hill that your house is going to be moving left and right.
Yes.
You know, you have to make sure that. Have you guys ever gone to a house that's beautiful but the landscape it's ugly? Like, have
Yeah.
you guys ever seen that? And then the landscape makes the house 10 times better. I mean, probably not 10 times better, but it looks way better with the grass and the trees and the flowers and the street going to the house and, you know, all the brick layering. That's exactly the same thing on your smile. Pink, you said, what is it called? Pink
Aesthetic.
aesthetics. So your gum has to be on point for your smile to be on point. So sometimes you guys show us teeth, but maybe we can't deliver those teeth if your gums are not ready for that to be delivered.
Yes, and
That's
nobody
very
notice. Nobody notice in the real life, like, as a patient, as a person. But when you see some smile which doesn't have like the correct pink aesthetic, it looks like, okay, looks good, but it's something, I don't know. It's not a beautiful smile.
Huh.
She had very good teeth, but I don't know, something's going on. And the pink static is something that you don't see, but you see.
You don't see, but you see. You don't see,
Yeah.
but it makes a huge difference.
Yes.
It's like having a good drink with your meal,
Yeah.
you know? Or what about sitting in an airplane with a comfortable chair?
Yes.
Perhaps a little bit better? Yeah? Okay.
Yeah.
I like it. You know, I never thought about that because yeah.
Yeah, but we got to see everything, all the environment before touching the patient. So I'm not gonna start a treatment that I don't know how will be the outcome in, I don't know, tomorrow could be, or 2 months or
Yeah.
3 months. I gotta make sure before what I have to do before start with the patient. And that's why we never choose between, we don't negotiate with this. Aesthetic or functional.
You know, it always goes back to planning,
Yeah.
to plan the cases. It always goes back to that because a lot of people don't plan their cases. And then, well, you know, I was thinking it was going to come out, well, if you would have planned it,
Yes.
it would have worked out better. Okay.
Yes. Nobody plans to fail,
Okay.
but a lot of people fail because they don't plan.
Oh, did you get that one?
Yeah. And it's
Nobody plans to fail,
yes.
but not a lot of people plan, and that's why they fail.
Yes. But they fail because they don't plan.
Wow.
Yes, happen a lot.
Pink aesthetics. I like it. Well, Dr. Dulce, what were you going to talk about? Dr. Dulce, you know what? I got to go.
I have a patient.
I got to
already.
call real quick. I got to go real quick. That's very important. You know, it's very
Yeah.
important. And I think Dr. Dulce also right now takes a look at a lot of patients, and a lot of patients ask for something that's not doable because of the platform that they're in. You know, everything is not the same. You know, sometimes someone smiles. For example, in my situation, when I smile, my lip, this bottom of my lip's a
Yeah.
little bit lower.
Yeah.
But when I pick up my lip, my teeth are, nothing's wrong with my bite.
Yes, straight.
But it gives the illusion of like if something was wrong.
Let's group.
So it's on you guys. It's on the professionals that's working on your mouth to be able to see, hey, this is not working. Hey, this is where we're gonna go, and that's what you really want. You know, you want somebody who's actually looking at all those details, because if I'm gonna get my house built, I want the architect to tell me, hey Frank, you know what? You're in the flood zone. When it rains, your house is gonna flood if it's at this angle. Let's add more dirt. Let's make your house higher so this doesn't happen. I don't want to build a beautiful house and then water starts coming in. Then I'm just like, hey, why didn't you tell me? Well, you know, I built a beautiful house. Yes, but you should have known this because you're the architect. You guys are the architect of these people's smile.
Yes.
So that's why you guys got to let them know. Do you think a lot of dentists, what do you think is the percentage of dentists that actually look at all these things? Let's just, I'm not going to say worldwide. Let's say here in town.
Here.
How many people do you believe, how many dentists really, like in your heart, don't say names,
Okay.
but do you think that really look into that? What percentage do you think that really plans someone's smile? Or just, or how many people just do it and let the lab figure it out?
Well, I only know like 3 or 5.
3 or 5 dentists that plan?
Yeah.
Out of how many?
We are like 1,000 or more here.
What about you?
I'm gonna say the same, like less than 5%.
Less than 5%?
Yes.
And that's crazy. And then you blame the lab. Hey, I need this to be a little bit longer, but the lab didn't see everything. They just see
Yeah.
your impression.
Mm-hmm.
You know, if it's digital, they'll see a little bit more, but it's you. You guys are the ones that have to figure it out. And that sometimes our patients, when they come in, that's why I always say, let's give us a little bit. You know, Monday, Tuesday, you want to leave on Wednesday. Well, it's your smile. You know, give us another day. Give us another 2 days, because We want to make sure it's perfect. And we want to make sure it's perfect for you. The one that's going to leave out with the smile is you. Not you, the dentist, you, the patient. You're the one that's going to have it the rest of your life. You're the one that's going to eat with it. You're the one that's going to sleep with it. You're the one that's going to talk with it.
Yes.
So let us do our best job and give us the time to perform it.
Yeah, that's very important, and that's true. Because you don't want to risk the next 10 or 15 years of your teeth for the day. You're risking everything for, okay, I want to leave, not tomorrow, I want to leave today.
So for one day, you're
Yes.
risking for the next 10 to 15 years, you not being 100% with your new smile.
Yes. Because they're going to be with you the next 10 or 15 years. So you want it good, and you don't want to risk so many time for one day.
Okay.
Yes. Or the patient that you start like, how many hours are going to stay here? Okay, I need 2 hours, but maybe can be a little bit more.
Yeah, it's impossible sometimes.
Yeah.
We say, well, how long are you going to take to prep my teeth? Well, it could be 2 to 4 hours because it just depends how many times you got to get up to the bathroom. Are you going to open enough? Are you not?
Are you tired or not?
Are you
the anesthesia
tired?
is working, or
Are you, how
the
hard?
part
How
of your
hard are your teeth?
body.
How hard are your teeth?
How many cavities you have that I have to feel?
Yeah.
and then they start to pushing us or rushing us like, at what time that you are going to see me tomorrow? Okay, if I need an extra day, you can stay.
Yeah. I like it.
Yeah.
Okay. Well, Dulce, it perfect segmenting to you now. What did you want to let everybody know about aesthetics that you believe?
Okay. Well, I have a lot of the coordinators. They send me a lot of pictures of the patients. That, hey, these patients, they want veneers. Oh, you know what? For the position of the teeth, I cannot go ahead and do it. Maybe I can do veneers in these ones, but I can do crowns on the other 2 or 3 teeth to play with the angle, with the position. And they told me like, no, they want everything veneers. And you know what? I cannot go ahead and do it. Let's use braces. Okay, but the patient needs to wait like 2-3 years to do it. Okay, that is another thing. When the patients, they remove the braces, they just want to run to the office and, hey, you know what? Do my smile makeover. And yes, we can do sometimes, but the patient, they need to know that they need to wait at least between 4 or 6 months before they remove the braces, because it's a osteoremodeling.
Remodeling.
The tooth, they need to attach again to the bone. When they remove the braces, the teeth, they start to move on like wiki. They dance again. So
Yeah.
if I do my procedure like that, with the time, your teeth, they going to keep moving. So the veneer or the crown, they can shift a little bit. So just that. Just take the time to your body to heal, to do the things of the correct way. Or other patients that they have really pretty teeth and they have mobility, like periodontal disease or gum disease. Sometimes I need to cut the gums to do the crown lengthening, and they don't want, because they don't want to wait like 2 months. But your smile, they're going to look so pretty if I need to do it.
Now, we do understand that sometimes if somebody comes from New York, you know, but we got to let them know, hey, the best thing would be first do this and come back 2-3 months later. If you don't want to get it done, if it's just aesthetics purpose, we will let them know. But if it's something that they got to wait, then they got to wait. We cannot skip any steps, you know. It's their, then those are the patients that are going to be calling later on and letting us know, well, gosh, I wish it was like this.
Yeah.
Well, you should have listened to me. You should have just waited just a bit, you know?
Yeah, sometimes we don't can do like the picture because the arch of the patient it's different. The bone structure, the lip, the gums, it's very different. Sometimes we can play with the gum contouring, with the fillings, with the Botox, but sometimes not.
Okay. How many times do you believe that patients come in? So, all right, let me restructure this question. So, out of 10 patients that are coming in for veneers, how many do you think are actually can get veneers done? Out of 10.
Like 5.
So 50%.
Yeah.
Now, out of everybody who wants veneers, there's a lot of people out there that have crowns. That people think that they have veneers. Do you think nowadays with the technology, veneers and crowns, can you tell, like obviously you specialize in this, but if somebody has veneers or has Emax crowns, by just, let's say for example, George.
Yeah.
If George had veneers, which he doesn't, but if he had veneers, or if George had veneers or if he had crowns, would you be able, just by looking at him, be able to tell if he had veneers or crowns?
No.
You would have to open his mouth.
Yes.
So crowns, with Emax crowns, have came a long ways.
Yeah, the Emax crowns or veneers, they look like the same. But if I see that somebody else have zirconium crowns, they look a little bit different than the Emax.
So when you tell somebody you can't get veneers, but you can get Emax crowns, it's gonna look just as good.
Yes.
Because some people are like, oh man, I really want veneers. It's gonna look just as good.
It's going to look like the same.
So you've been to Prague, you've been with the top dentists in the world for aesthetics, and you cannot tell by looking at someone speaking if they have veneers or Emax crowns. That's amazing. That's technology, because metal porcelain, remember they were bulky, like chiclets, and they were like rounded they had like a little belly, and now they're flat and all that stuff. So that's technology.
Yeah.
That's amazing.
And other thing, it's with the time, the metal with porcelain, they make like a tattoo on your gums.
Like a black line.
Yeah.
Yeah. And with Emax, you don't got
No.
that. You don't have that.
Yes, and the porcelain is translucent, so you can see the metal through the porcelain and turns like gray.
Or
So isn't that a good looking?
orange.
Yeah, something that you don't want on your mouth. And also, porcelain, it's like rough. The surface is not very soft. So it keeps plague, bacteria, and it's stained with the time. So much better zirconia or Emax. Well, both are kind of ceramics. So
Yeah.
just to let the people know, they are different ceramics. They are metal free. This is like the best on the aesthetic.
Can Emax stain? Can veneers stain with wine?
No.
No, not really.
Can they stain with coffee?
No.
No, it depends on the surface of the material. When it's soft, when it's polished, it's not gonna stain.
When it's polished. So when it's done right,
Yeah.
Yes.
it's not going to stain.
No.
So if your Emax at home is staining, or your crowns are staining, and they're supposedly Emax, either they're not Emax or they didn't leave them.
Or they
Smooth.
can come to the office and just we polish.
No, I'm talking about
Someone else.
someone else.
Another
no.
Right.
office.
Right.
Our office, no.
Okay. How many people do you believe, now that I have a lab, now that we have a lab, I'm starting to see how important materials are. For example, on 4 and on titanium. Emax is a brand, right?
Yeah.
Yes.
Sindicato de Litio, which is lithium syndicate.
Disilicato.
What I said?
The
Lithium disilicate.
Okay.
Lithium disilicate.
Is there better than others? Brands for disilicate, which is Emax, but Emax is the brand.
It's a brand, yes.
Which they did a great job doing it, because see, back in the day when I used to go to a hotel, me and my wife,
Yeah.
I'd be like, I want a jacuzzi in the room. Now, it wasn't a jacuzzi. I wanted a hot tub, The
Yeah.
Jacuzzi was the brand. Before we had Eternal Beauty. See, you didn't even know that. See, you didn't even know that.
No.
Before, when before we had Eternal Beauty, I used to say, "Damn, that girl looks like she has a lot of Botox in her lips." I didn't know Botox is a brand,
brand.
and it doesn't go on your lips. Botox doesn't even go on your
Or
lips.
on your face.
But they did such a great job, these companies, that when you see something, you know, oh, I want a Jacuzzi. That's a brand. Oh, I want like when they
Liquid paper.
say I want in Mexico, they're like, oh yeah, can I get some Kleenex?
Yes.
No, it's not a Kleenex. It's a tissue.
It's a brand.
A Kleenex is a brand. In Mexico is, can I have some? They're not papitas or sabritas. Si me das unas, can I get some sabritas of this?
Yeah.
Sabritas is the brand.
Yeah.
You know, Emax did a good job. Maybe in the future we can work. Maybe in the future they're like, yeah, can I go? I want to go to that Supreme clinic, and it's just a dental clinic.
Yeah, absolutely.
That would be amazing. That would be amazing. I don't know if that's ever going to happen, but that's a goal right there. Anything else you guys want to touch on before we leave? Anything else you want the world to know about cosmetics?
Yes.
That you would advise patients when they come down with us or with anybody else in the world that you guys would want them to?
Yeah, I think that the question you just did, it's a very good question. How important is the brand? I'm gonna say that 50% of the success rate will be on the brand,
Really?
or probably not too much. But the most important here is every material has its indication. So if you do the right thing with the right material, that's gonna work. And also the brand is gonna give you a plus, because if you're using good materials, they're gonna last as they supposed to last. So, but the most important is doing a very good diagnosis and knowing what are you doing and what you have to do to fix whatever you're gonna fix. So each material has its own indications, and if you do it right, that's gonna last for a long time.
Anything else you have to say?
That's correct.
Yes. Yeah.
So, you know, I want to thank you guys because I know being our doctors in aesthetics is not really easy. And aesthetics is, you guys are building something on something that's already been built. So when you guys do surgical, for example, our doctors that do all M4, they take everything out and then they redo everything.
Yeah.
You guys have to work on things that are already there and you got to make them better. So sometimes it's easier to just take everything out.
Yes.
That's the way they want to do in the United States. Clear choice. These companies, let's take it out. You come in, you have a new smile, everything's ready to go. You know, extracting is the last option that we want to do.
Absolutely.
But you guys go above and beyond and make a smile look. The smile looks like it's throwing gang signs. You know, the teeth look all like this. And then you make, you know, and it's funny because it's true. We've had patients that come in, and I'll see if I could put one here, that it looks like their teeth are throwing gang signs, like it's all twisted. And then you guys make them all nice. So building something on top of something that is pretty destroyed and making it look aesthetic and functional is what you guys do. It's amazing. Not always is that the best route. Sometimes you have to extract everything, and then we have to go for the all-on-4, all-on-6. That's completely fine. But most of these doctors nowadays, and I'm pointing fingers mostly at the United States because that's what I see. It's rare when I hear about aesthetics. I hear about taking everything out, putting everything in. It's going to be very aesthetic, but it's not going to be what it should be because it's not always the right decision. So I want to thank you guys because I know you guys put in a lot of hard work into aesthetics, and I know you guys put in a lot of hard work into studying, into representing, and I know that 2026 is going to push us to the next level, and I'm pretty sure there's going to be courses.
Yes.
And I'm pretty sure there's going to be different things that we're going to do. I know you talked to me a couple of things that you want to do, and I'm excited. I'm very excited. You guys know there's an application coming up, and that's going to show people what animated AI smile, but through a lab, what it's going to look like, that's kind of scary because it might be super good. So when they come in, they're going to be expecting something super good. So I'm very excited and I'm very happy to have you guys in the team, and you guys are very picky. Not a lot of people know, but I'm actually reconstructing my mouth, and Dr. Dulce is going to be reconstructing my mouth.
Yeah. And he's very picky.
And I'm extremely picky. And I said, if you think this is going to be easy, you don't know what's coming. And Dr. Adolfo also had some suggestions, which I thought that Dulce was going to choke him. But she, we work here as a team. So
Yeah.
I want to thank you guys so much for being here. I know that you guys are busy, but it's very important to get out there to the world and let them understand a little bit more about what can we do, what can we not do. And it comes to me as a surprise. The pink aesthetics, I didn't know about. That's amazing. That's great. And I didn't know about that, even though you have such high level of learning, and you have such high level of accuracy in what you're doing in veneers and aesthetics, you cannot tell someone when they have veneers or when they have just amazingly well done Emax crowns. That's a plus. So thank you so much for being here today.
Thank you.
Thank you so much, George, for recording this today. And everybody at home, thank you for staying this long. This has been Supreme Dental Podcast Studio, powered by Supreme. And just like these doctors right here, keep on smiling.
This the pod, speaking facts, trying to teach, talking health, talking teeth. Supreme Dental, Supreme Dental, Supreme Dental. This the podcast.